What's up, YouTube? Welcome back to another video with yours truly. My name is Julia and I am a third-year medical student. So today I wanted to drop another video in my Rotate With Me vlog series. So the purpose of my Rotate With Me vlog series is to highlight and document my journey through my third year of medical school. In this series, I will be showing you the different specialties of medicine, how it is to be working as a student in those different specialties, as well as the pros and cons of each. It is through this series that I am going to try to get a feel for what I want to do with the rest of my life and which specialty I will ultimately decide. So I wanted you guys to take this journey with me and show you that side of what it's like to be a medical student. So currently I am on my OBGYN or obstetrics and gynecology rotation. So all things women. So the OBGYN rotation is 6 weeks total, with the first 3 weeks being gynecology and the final 3 weeks being obstetrics, which is everything pregnancy related. This video will be focused on my time in gynecology, and the next one, part 2, will be focused on my OB experience. So let's go. Okay guys, so right now I am on GYN or gynecology, and it is Tuesday morning, 7:30 a.m. and I am about to scrub into a surgery. So these are the ORs, guys. Here is the scrub counter where we scrub. So we use a pack of these and scrub into surgery. This is the scrubbing kit. This part right here is for your nails. Super cool. Hey guys, just got out of the surgery and now I'm having a coffee in my favorite hospital spot in this little cafe. So I'll show you. It's a really small little cafe. It has a TV up there, so I just sit here, eat my snacks, drink my coffee, mind my business. But anyway, so the case was actually a pretty shitty one. We were doing a diagnostic laparoscopy, and it was on this middle-aged woman who had this large, like huge pelvic mass. And we basically were going in to explore what that mass could be, with the options of either just taking a biopsy and then that being it, or removing the mass in general. So once we got into her pelvis, we took some samples and it was highly suspicious to be cancer. So we sent the tissues for frozen pathology, which they can process them immediately while the surgery is going on. So we sent some tissue samples from the mass, and I kid you not, guys, this mass was huge. Like, it was like the size of my head in this woman's abdomen. And we sent the tissues, pathology came back, within like 5-10 minutes, and it was cancer. So it was cancerous cells, ovarian cancer. So we just ended up closing her back up because she also had metastases to other parts of her body. And so we sutured her up. The doctor let me do some sutures, and she's just gonna get chemo, and possibly we'll come back to resect the masses at a later date if possible. But it's really sad. The woman was so nice. I spoke to her this morning and she was just so lovely. So of course you don't want bad things to happen to any patients, but especially the ones who are just so caring and so loving. It just really hurts to see. But overall, the surgery part of it is so cool. So this is a laparoscopic surgery simulator. So there's a little camera in there and it's projecting on the screen. So if I take a tool, put it in the hole, and look at that! And you could practice your skills.
How many? She was 35 and what? 35 and now.
Oh my God. Look at me, you guys. Talisha, how are you doing over
What? I don't even think this thing is white. Oh, this is to cut. I don't want to do it.
So before beginning my OBGYN rotation, specifically the gynecology portion, the only experience I had with gynecology was my own experiences, my own time seeing an OBGYN and getting, annual pap smears or birth control, etc. So I had no idea exactly what to expect when going into this rotation. So I was pleasantly surprised that actually a lot of gynecology inpatient or in the hospital, because that is what I am seeing, is surgery, a lot of surgical procedures. So when you think about it, gynecology, in which we typically experience, is outpatient or in the clinic, you know, getting birth control or getting annual pap smears. But inpatient, when you're in the hospital, it's more emergent, right? It's more serious things. So these are people who have fibroids that are causing so much pain in their pelvis or in their abdomen, or polyps or cancer. And these people need surgery or procedures to help them. So that is a lot of the gynecology that you see when you are actually in the hospital. However, when I was in the clinic, which you will see, a lot of that is typical, you know, annual checkups or follow-ups and things like that. So it was very interesting to see the differences in inpatient versus outpatient gynecology. Hey guys, so today I am in clinic. So there is the hospital across the street. I just crossed through the bridge and I'm gonna be in clinic today seeing patients in the oncology clinic. So this is what clinic looks like. This is a typical clinic room. You can see, very basic. So in OBGYN, you are actually on your feet a lot, especially because you do surgery. So you stand a lot, and my feet were killing me by like the second day. So I actually invested in some clogs. So as you can see, I have my nice little Calzero clogs. So comfortable here. We are getting ready to do a procedure called a LEAP. So we use electrocautery, this machine here, to cut out part of the cervix if a patient has cervical dysplasia. Put a condom on the handle because it's easier to clean. Okay guys, just finished in clinic for the day. So I was in OBGYN clinic. Now I'm headed back to the hospital to finish out my day. Come on in. And these are new. Sorry guys. But we have to take our temperature.
Please align your face in the outline. Please proceed. Okay, I'm gonna walk around into the main den.
To test for COVID. It's always a great morning when the attending doctors bring bagels. Hey guys, it is Friday morning and I look exhausted and I have to work tomorrow to day call 7 to 7, but it's totally okay. The week is almost over. It is almost 8 a.m. I am about to eat some cafeteria breakfast. And as you know, I am still on OBGYN. This is my last week of GYN, and then I will go into 3 weeks of OB, obstetrics, labor and delivery, all of that. But today is Friday, and on Fridays we have TOP clinic, or termination of pregnancy. So these are elective abortions or procedures that women are coming in to have in order to terminate their pregnancies. So I'm getting ready to eat breakfast, and then I will be doing 2 of the TOP procedures today. So I'm kind of excited to see that aspect of OBGYN and participate in those procedures. So I will let you guys know how that goes. Alright guys, so I'll finish out this video talking about my experience with TOP, or termination of pregnancy, or abortions, elective abortions. As you all are probably aware, elective abortions are one of the most controversial and highly politicized aspects of medicine to date. And there are a lot of laws and barriers in place, such as insurance policies and cost, that prevent people from getting access to these procedures that they want and that they need. But all of that aside, actually being present for the procedures was very interesting. I had to go see the patient in the morning and talk to them and answer any questions that they had, and then I was with them through the duration of the procedure and then after as well. And each case is different, but the reason why I put the graphic warning label is because in talking about this, you know, it does make some people uncomfortable, even OBGYNs. Even if a person is an OBGYN physician, they are not obliged to do terminations of pregnancies. They can refer their patients out to a provider who does do these types of procedures, because everyone has a different sentiment around this aspect of medicine, and it's completely okay. I remember the doctor telling me when I stepped into the operating room for the first termination, and she said, you know, even if you may be pro-choice and you're very much so in support of this woman being on the table and getting this procedure, that doesn't always have the same correlation to you actually being present in the procedure and seeing, you know, like the remnants and all of that. So it's completely okay to not be okay in the OR, or if you have a feeling of I shouldn't be here, I should step out, step out. So as far as my experience, I saw 2 TOPs on Friday. They were both about 15 weeks along. And I was going to include some pictures here, but I decided against it, and I'd encourage you to just Google it if you're interested. But you can get a sense of how large the fetus was or how developed they were. But it was still interesting nonetheless to see the procedure happen. So the type of procedure that one can use in order to terminate a pregnancy can vary, especially depending on how far along the pregnancy is. But most commonly, one uses something called a DNC, or a dilation and curettage, which basically means you dilate the cervix, so you open up the cervix a little bit so you can see into the uterus, and then you suction out the pregnancy using a suction machine. So the interesting and new part for me to see when I was there was that you have to take the machine, the suction machine, and empty it out and actually sort through the remnants to ensure that all of the fetal parts were there, so that you are confident that no fetal parts were left inside the woman's uterus that could potentially cause hemorrhage or infection later on. So you sort through the parts and kind of put the extremities back together and the spine and the skull. So it was interesting. So as a science nerd and, you know, a medicine buff, it was kind of cool to sort through these parts and really get to see and feel what these parts are at this stage at 15 weeks that are inside the uterus, because you typically don't get to feel or see these parts, right, except on ultrasound. So it was very interesting, and if you guys have any questions, please comment them and I'd love to elaborate. And overall, I just really enjoyed it, you know, like personal thoughts or opinions about the actual active TOPs aside. I think that it is a part of medicine, and if you are an OBGYN, it's a part of your specialty. And so it was very cool to see that part, and I think that it is such a personal and intimate procedure for a woman. So for me to be present and hold the woman's hand through the procedure and be there before, during, and after, and, you know, console them through it, I thought it was so amazing. And that is why I wanted to become a doctor, right? To be with people during their most vulnerable and intimate times. And for a woman, this could definitely be one of those moments. So overall, I'm just grateful to have had the opportunity to experience those procedures. All right, guys, so tomorrow, Monday morning, I will be starting obstetrics, OB. So I will be delivering babies and seeing a lot of pregnant women. So super excited about that. As always, if you have any questions or thoughts or comments, please drop them in the comment box below. I love reading what you guys have to write and hearing more about your stories. Please like this video, give me a thumbs up, and subscribe so you can tune into all the latest content that I will be dropping. Reminder to be safe, wear your masks, social distance, and vote in November, please. All right, love you guys. See you next time.